Dr. Georgia Eady is a psychiatrist and nutritionist who has written a new book called Change Your Diet, Change Your Mind. In this conversation, she discusses how most people have been feeding their brains improperly for their entire lives due to receiving incorrect information about what constitutes a brain-healthy diet. Eady argues that if we give our brains the proper nutrients and remove damaging ingredients from our diets, we can expect much more from our cognitive function and mental health. Eady describes herself as an accidental nutritionist because nutrition was barely covered during her medical training. It was only through her own health challenges that she began exploring the connection between diet and mental health. She discovered that much of what we're led to believe about nutrition is incorrect, and she fell in love with nutrition science and brain metabolism. Eady points out that over 1 billion people worldwide have a mental health diagnosis, and psychiatric problems are becoming so commonplace that poor mental health is beginning to be seen as normal and inevitable. As a clinician, she finds this heartbreaking both on a grand scale and when dealing with individual patients. Eady believes that dietary changes can be a powerful mental health intervention, often helping people in ways that medications cannot. Eady identifies 5 categories of foods that she believes are most harmful in the modern food environment. 1. Refined carbohydrates, sugars, flours, cereal products, high amounts of fruit juice. 2. Vegetable oils, refined fats from seeds like soybean, cottonseed, grapeseed, and canola oil. 3. Alcohol. 4. Grains, legumes. She explains that refined carbohydrates turn instantly into glucose in the bloodstream, causing unnatural spikes in blood sugar and insulin. This leads to inflammation, oxidative stress, and potential damage to various tissues, including the brain. Vegetable oils are unnaturally high in linoleic acid, which the body is not designed to handle in large quantities. Alcohol is damaging to multiple organ systems. Grains and legumes, while often touted as healthy, contain anti-nutrients and defensive toxins that can pose risks to thyroid, gut, and immune health. Eady argues that many popular dietary recommendations, including the Mediterranean diet, while better than the standard American diet, are not optimal for brain health. She explains that while studies have shown benefits of the Mediterranean diet for conditions like depression, this doesn't necessarily mean it's the best possible diet for mental health. Eady believes we can do better by focusing on whole foods and removing potentially damaging ingredients like grains and legumes. Eady emphasizes the crucial role of metabolic health in overall well-being and mental health. She points out that in many Western countries, over 90% of the adult population has some degree of metabolic dysfunction. This widespread metabolic unhealthiness makes it particularly important to be cautious with foods that can spike blood sugar, such as grains. While acknowledging that whole grains and legumes are often recommended as part of a healthy diet, Eady argues that they are the least nutritious and riskiest whole foods one can eat. She explains that they are low in nutrients, often requiring fortification, high in starch, which can be problematic for those with insulin resistance, and contain defensive toxins and anti-nutrients that can interfere with nutrient absorption and potentially harm gut and immune health. Eady recognizes that legumes, in particular, are important for those following a vegan diet due to their protein content. However, she maintains that for most people, there are no compelling nutritional reasons to include grains in the diet, and the potential risks of legumes may outweigh their benefits. Eady emphasizes that changing one's diet can lead to significant improvements in mental health, often within days or weeks. She encourages people to adopt a curiosity mindset and be willing to experiment with dietary changes to see how they personally respond. While she believes that removing all 5 categories of harmful foods is ideal, she acknowledges that any positive changes, even if not perfect, can be beneficial. Eady discusses her own research on the use of ketogenic diets for mental health conditions. She co-authored a study involving 31 treatment-resistant patients with schizophrenia, bipolar disorder, or major depression. The patients followed a mildly ketogenic diet in a hospital setting, and the results were remarkable. Every patient improved. 43% achieved clinical remission from their primary psychiatric diagnosis, and 64% left the hospital on less psychiatric medication. Additionally, all patients saw improvements in their metabolic health markers. Edie considers the ketogenic diet to be the cornerstone of her work with patients, as it fundamentally changes brain metabolism and can lead to rapid improvements in mental health symptoms. However, she cautions that it's a powerful intervention that requires proper support and supervision, especially for those with existing health conditions or on medications. Edie addresses several common concerns and misconceptions about nutrition throughout the conversation. She challenges the idea that certain foods like red wine or dark chocolate are superfoods that can be added to an otherwise poor diet for health benefits. Instead, she emphasizes the power of subtraction, removing harmful foods from the diet rather than simply adding supposedly healthy foods. She also discusses the misconception that healthy diets must be expensive. Edie argues that eating a whole foods-based diet can actually save money in the long run by reducing the need for medications, doctor's visits, and expensive processed foods. She gives the example of her mother, who eats a healthy, low-carb diet on a limited income by focusing on less expensive cuts of meat and avoiding processed foods. Throughout the conversation, Edie emphasizes the importance of individualized approaches to nutrition. She recognizes that what works for one person may not work for another, and encourages people to experiment with different dietary strategies to find what works best for them. She also acknowledges that while she believes a diet free from grains and legumes is ideal, this may not be practical or desirable for everyone, particularly those following vegan diets for ethical or environmental reasons. Edie discusses the lack of nutrition education in conventional medical training and how this has led many physicians, including herself, to have to accidentally stumble into nutrition research. She expresses frustration with the incorrect nutritional information that has been promoted for decades and hopes that her work will help people understand the biological basis for making dietary choices, rather than relying on outdated or incorrect nutritional dogma. Dr. Georgia Eda's work represents a paradigm shift in how we think about the relationship between diet and mental health. By focusing on removing potentially harmful foods from the diet and nourishing the brain with the right nutrients, she believes we can significantly improve mental health outcomes for many people. While her approach may be considered controversial by some, particularly her stance on grains and legumes, Ede bases her recommendations on her understanding of human biology and metabolism, as well as her clinical experience with patients. Ede encourages people to approach their diet with curiosity and a willingness to experiment, rather than adhering strictly to any one dietary dogma. She emphasizes that while dietary changes can be powerful, they are not a panacea, and other factors, such as sleep, stress management, physical activity, and addressing trauma, are also important for overall mental health. Ultimately, Eda's work highlights the need for a more nuanced and individualized approach to nutrition, particularly when it comes to mental health. By understanding the biological effects of different foods on our brains and bodies, we can make more informed choices about what we eat and potentially improve our mental health and cognitive function in the process.